Hello and welcome. This is Terry Maxiner, and this is Bridging the Gap of Care, resources that you need for facing the reality of aging. And I say a big welcome because we are Facebook Live, and you can also see this video in a recorded version on my YouTube channel that will be coming soon. So welcome again, and today we're going to be talking about the empowered elder. You know what, elders? You are 70 million strong, and your ability to navigate through those years that we have people living well into the 10th decade, those golden years, we want you to be secure and have a quality of life. But there's some key factors to becoming that person that's happy and healthy and productive. So today I'm just going to talk to you about 3 challenges, and they're not unique challenges. And these challenges are chronic diseases. The other challenge is cognitive decline. And the third challenge we're going to look at is the social and economic limitations that can happen. Chronic diseases, it's inevitable. Unfortunately, as we age, diabetes, cardiovascular, neurological diseases can happen. And with that is a real increase in the healthcare. So costs are going up, emergency visits are going up, things are happening because of these chronic diseases. It does increase our death rate, and we don't want that to happen. So what can you do? What can we do as someone who has a chronic disease? Well, the first thing I start with is educate. Know what your disease is. Know what the prognosis is. Know where those normal levels need to be. Behavior changes. Accept the disease. Accept what space you're in right now with that. And as you educate yourself and move forward and learn more about it, you've got more ability to keep that disease in check and balance. Make good choices. As we're aging, it's always about our diet, our exercise, good sleep, maintaining our medication regime as it's ordered by our doctor, seeing our doctor regularly, having those yearly checkups. When we're having symptoms that are starting to get worse, keep a check and balance on that. Don't wait till an emergency happens. The other important thing we have to look at is cognitive decline. Well, every 67 seconds, we do have someone being diagnosed with some form of dementia. And those numbers are only going to increase. We think by the year at least 2050, it could happen every half a minute. That's a lot of people. And the predisposition is the older I get, the more it is that I may get some form of dementia. So what is my plan for that? Well, if you don't use it, you're going to lose it. And what I mean by that is brain fitness. In one of my video podcasts, I had a great friend come in, Trisha, and she's with Inspire Senior Care, and she talked about how that mental and brain fitness is so important. So do look at that video podcast when I had Trisha Janasi on here, and it was just fabulous information about brain health and how, like any other part of our body, we've got to exercise it and use it. Also, the other thing is we want to stimulate our brain, learn new things, be that lifelong learner. And of course, the most important thing is keeping our stress under control as best we can. Well, the third is social and economic limitations. We need to have a really good, honest opinion of where our finances are at. Do we have our power of attorneys in place? Do we have a financial planner that can look through our future needs as we're aging? Do we have our financial plan in place? Do we have our POST form, which is that form that tells the do's and don'ts of how I want to live out my life? Have I met with an elder care attorney? And I tell my clients and many other consultants that I work with is look for that. And that would be that elder care attorney, that CELA, that certified elder law attorney. Know the cost of care. Know what some of these pricings are for independent living, assisted living, memory-supported assisted living, skilled care, long-term care, supportive living, all these terms. Again, the cost factor with that and understanding. The other important thing is know who pays for what. What does Medicare cover? What does Medicaid cover? What does long-term care cover? So again, it's really being cognizant of about all those things, their cost factors, and truly what we're paying for. Every year, re-looking at your Medicare coverage. Is it time to maybe change to a Medicare Advantage plan? Would that be beneficial for me? So that does come to my very last piece, and that's planning. And everything has to do with your healthcare team, your primary care physician, any other ancillary physicians that you may have. Who is that person I need to reach out to? What are my vulnerabilities? Do I have someone to call in that case of emergency? Who can help me navigate? As a part of my business as an elder care consultant and elder care manager, I have been called many times with older adults or their adult children on helping them get a map and get a plan. Another resource that is valuable is the Aging Life Care Association. And another one is villageplan.com. So again, there are care managers out there. Normally they've been nurses or social workers that are ready to help and help navigate if this is so overwhelming for you. So again, just to kind of wrap things up for you, what is my best advice and my best recommendation? Stay active. Be a lifelong learner and plan wisely. I thank you again for joining us on Bridging the Gap of Care, resources for those facing the reality of aging. You can see these videos again on my YouTube channel, or you can reach out to me, www.bridgecareconsulting.com. Thank you.